And in case you're going through any phase of depression, any phase of it to a point where you feel suicidal, I have the National Suicide Prevention Helpline here that I'd like you to write down. Maybe not for you, it could be for a friend. Somebody might need it. Then this is a toll-free number. The number is 0800 678 678. 0800 678 678. And this is the National Suicide Prevention Helpline. Welcome back from the commercial break. I am your host, Dr. Ann Sansa Daly, and today we're going to be talking about depression, which is a subject that we rarely talk about in our communities, especially in this part of the world. Today I have here with me two wonderful, amazing doctors who put their lives on the line to take care of people every day. I have here with me Dr. Omane Echamfor. Okay. And you happen to work with Kolebu?
Yes, Kolebu Teaching Hospital. I'm a resident surgeon, or a resident surgeon. You could say that. Yeah.
And I have my second guest to be Dr. Comfort Ajay,
yes,
who is also a psychiatrist.
A resident psychiatrist.
Okay,
yes.
Great. And what hospital?
So I'm currently with Pantine Hospital.
Okay, that's amazing. So with the subject that we have going on today, we're going to be talking about depression. This part, we don't really talk about it because we feel it's nothing to worry about.
Yeah.
But it's actually very deadly.
Yeah.
Yes.
So, can somebody help us out with what depression really is?
Okay, so thank you so much, Dr. Daly. Like you rightly said, in our communities, largely due to the kind of stigma that's attributed to lots of these mental health disorders, I think we usually classify or we group all of them, whether it's depression or whatever it is, as this person is mad. Yes. So whether you're bipolar or whatever, anything, as long as it's a mental problem, people classify you as either you're mad or whatever. And then we don't tend to see these issues as medical problems. For example, like someone having the malaria and going to the hospital and getting a tablet of artemether-lumefantrine or chloroquine and then getting helped and then moving. So I think, like, coming from what you said, now depression is more of a clinical state that's formed when someone has largely these two symptoms, a depressed mood and anhedonia, that's disinterest, a generalized disaffection for life. You lose interest in things that you were naturally interested in. So maybe take, for example, maybe I'm a big football fan, I'm a big Real Madrid fan, and then all of a sudden I lose interest. If, let's say, I was an Arsenal fan, and maybe this is in, they are doing better, but let's say I was a Man United fan, maybe this season I could go off. But let's say my team is doing very well, like I'm a Madrid fan, the team is doing well, and I'm disinterested in football.
Suddenly.
Yes, suddenly. Or maybe I love eating. All of a sudden, I'm not eating again. Then I could have some form of depression. And then if I have this depressed mood, so a mood is slightly more than an emotion. Okay. Like emotions are very transient. Maybe I feel sad today, but that sadness could go off in the next minute or the next 30 minutes. But then if it becomes consistent, maybe the whole day I'm sad, then it's persistent, maybe the first day, second day, third day, fourth day, fifth day, it constantly goes on maybe for like 2 weeks and more. Correct. Then you could start to say that, you know, I have a depressed mood. It's not just an emotion, it's becoming my mood. And then coupled with other symptoms, like maybe suddenly I'm sleeping a bit more, I'm sleeping a bit less. I mean, my normal sleep cycle has been disturbed. You know, I'm starting to get easily tired. I become agitated easily. You know, when we put all these symptoms together, then we would say that you might be suffering from clinical depression. Yes.
So, Dr. Comfort Ajay, I have a quick question. With depression, do we have age limit? Do we have kids that actually suffer it?
So there's no age limit to clinical depression.
Okay.
Children suffer depression, adolescents suffer depression, yes, and adults as well. So it can affect anybody from any age at all.
So let's say a child is, let's say 5, 7, 8, 9, 10. How do you detect if this child is suffering from depression?
Okay, so their presentation is not like the usual that he spoke about.
Okay.
So for adults, we know we are dealing with depressed or low mood or feelings of sadness, which is pervasive for at least a period of 2 weeks, okay? Coupled with what he mentioned, loss of pleasure in activities you once enjoyed or the person once enjoyed. And then usually low energy. So someone wakes up in the morning, they don't want to do anything. They feel like they don't even have energy to go through the day. They don't even want to get out of bed. All these are core symptoms of depression. For children, they may present a bit atypically. So a child may start behaving in a way which is not usual of them. Okay. You know, kids throw temper tantrums and all that.
Yes.
But then when kids are depressed, they could start misbehaving. And sometimes you can't really tell what it is they want or why they are behaving in that particular way.
Correct.
But it could point to depression. Also, when kids are of school-going age, they could start performing abysmally in school. So maybe their grades will start going down and you wouldn't understand because maybe this was a child who was very good academically.
Okay.
You're trying to find exactly what the cause may be, and then you can't really tell what it is. They usually too will tend to sleep a bit more. Okay, so he mentioned a sleep symptom,
pattern, yeah.
exactly, that people tend to sleep a bit more or less. For adults, usually they may sleep a bit less or they wake up earlier than their usual wakening time. So we have what we call early morning awakening, typically in depression, exactly. So they could wake up 2 to 3 hours earlier than their usual time. And sometimes they don't even understand why they are awake and they find it difficult going back to sleep. Kids could, sleep a bit more. Kids could also overeat.
Okay.
Yes, so their presentation is a bit not, and sometimes you may actually get angry with a child and you may not even know that this is what is going on. They're suffering a mood disorder.
Correct.
So usually it's the academic performance that makes teachers and then parents sit up because they're trying to find questions. Why is this child not doing well in school? They are going to school. Why is it that they are not concentrating as much? And yes, poor concentration is one key symptom also of depression, both in adults and children.
Okay.
Exactly.
So at what point does a patient or does someone have to say, okay, I'm suffering from depression, I have to go see a doctor? Do we have any?
I think, as in for the so it's in twofold.
Okay.
It's like a dichotomy. It's a difficult dichotomy. Now the thing is, the sufferer, the one who's having the problem, is that person competent enough, confident enough, and how do I say that the person have enough awareness to understand that their problem has a remedy with a professional, because as I said from the beginning of the conversation, you realize that in our community, in our setting, some of these problems are largely attributed to spiritual causes, or there's so much social stigma like that, such that people who have some of these things, they don't even realize that it's a medical problem. So usually maybe a teacher, a friend, or maybe someone with some form of advanced training or enlightened training or a health professional would observe someone in the community and realize that, okay, this person has a problem. Or sometimes what happens is that they move from just normal depression to very severe depression, such that either they have they attempt suicide, or they do this grand things, and then realize that, you know what, you really have a serious problem.
Correct.
But if it's subtle, it usually escapes.
Yeah, they can live with it.
They can live with it.
So that's the whole purpose of this
Yes.
show. The purpose is to educate the general public.
Yes.
So in this sense, we're trying to make you understand what you're probably going through, but don't even know.
And the thing is, if you look at people going through depression, they might have very normal, regular faces.
Correct.
Yes, and sometimes they might even look a bit more happier than the regular person.
Gotcha.
Yes, but then they are hiding a lot of skeletons in their closet. So it's sometimes very difficult to just look at someone. I mean, if you look at some of the people who have committed suicide out of depression, you look at their pictures and videos, I mean, you won't be able to tell that this person has depression.
So when does it move from clinical to bipolar? Because I know bipolar falls under depression. So how do you know? How do you know which is which? Yeah, how do you know which is which? Yeah.
Okay, so depression does not really change into bipolar.
Okay.
So there are two different mood disorders. In psychiatry, they are considered mood disorders because they affect how you think, how you feel, and how you act. Okay. So when we talk about depression or clinical depression, we are talking about major depressive disorder.
That's it.
Okay. And that is what we've just outlined. Some of the symptoms, there are a lot more. Maybe we'll talk about them later. But basically, there's depressed mood, there's low energy, there's loss of pleasure in activities the person once enjoyed, and all that. Feelings of guilt and all the others, poor concentration, forgetfulness. And then they could also have feelings of helplessness. They feel helpless about the situation. They feel hopeless and they feel worthless. And it's at that point they can start having suicidal ideation because they don't even know, they don't think there's any use for their lives again. They feel like life is not worth living. That is depression, major depression. Now when we come to bipolar, like the name suggests, bipolar. So there are two poles.
Personalities.
Exactly. So, and the poles could be extremes of mood. So one extreme is the depression, which we have discussed. The other extreme is mania. Okay. Exactly. So in this case, in bipolar, in depression, the person just presents with depression. It could be their first episode, it could be a recurrence or whatever, because we have different types or different severities. But when we come to bipolar disorder, it means that in one person, at one point in time, they could meet the criteria for major depression. You understand?
Which brings us back to depression. That's why I went with those two.
So they are related, actually. Yes. So at one particular point, in one person, one individual, they could meet the full criteria for depression. Okay. Then sometime down the line, maybe some months down the line, they could also meet another criteria for mania. You understand? So it's one person. So maybe this particular time of the year, they present to the hospital and clinically they are depressed. Okay. Then they get better. Sometimes, even without medications, for people with bipolar, they could get better. You understand? Medications make the episodes shorter so that it brings them some relief and they can function. But then for some of them, even without medications, they actually could get better. And the episodes could last typically like 6 months, but they get better. Then another time of the year or another time altogether, they present with mania. So if I'm meeting someone for the, when I talk about mania, that one is more like high mood or highly elated mood. So it's just the opposite of depression. Depression is low.
And this goes high.
So in the manic phase, they are they feel like they have high energy, and some of them could get physically aggressive. They are destructive. They can just be breaking things, destroying things. Sometimes they could get physically aggressive, even to hurt people. And they are talking excessively. They have flight of ideas. So you're talking, you're trying to have a conversation with them, and they're moving from one idea or one topic just to the other. And it's like sometimes you can't even tell the connection. But they talk about this, they talk about that, all within a short period of time. And sometimes they could tell you about the ideas they are having. Oh, I want to be a musician, or I'm planning to do this, I'm going to medical, like a whole lot of things at the same time. But sometimes if you actually sit and then you track what they are saying, they may not have achieved anything in those fields. So those are all symptoms of mania. You understand? So for bipolar, it's one person, but at this point in time, they are depressed. At another point, they are manic.
So one thing I know is, now let's go to our finances. I know that actually can breed depression, homegrown depression. Sometimes what you have in your pocket actually says a lot. So in a sense like that, this is for the purpose of the show, where we're trying to make people aware of what could be happening to them so they can get up themselves and say, okay, today I'm going to see a doctor. I think I am depressed, for the purpose of the show. Like I said, at what point? I know you've cited a lot of examples where when your sleep pattern suddenly changes, when you suddenly have mood swings and all that. a lot of people are going to assume that, oh, it's one of those things that will pass. And it's true, it does pass. But at what point do I get up and say, you know what, I think I am suffering from depression.
Yeah.
I think I'm too broke and I'm depressed. So let me go see a doctor. So
are you depressed, or you're depressed because you're broke?
It's all depression.
Yeah.
Yeah, depression is depression. So at what point?
Okay.
So for educational purposes,
Yes.
at what point do you
Yes.
get up and say, okay, let me go see a doctor?
Yes. So I'm happy this show is going to be aired shortly so that people can learn some of the things that we are about to say.
Correct.
So like I was saying, sometimes people get to know, maybe family and friends will only get to know when you are in the severe stages.
Yeah.
Okay. Or when it's gone on for too long a time. Even though you can still get help, sometimes the person may have suffered for too long because it's very, debilitating. It's annoying, and then it's very oppressive. Let me put it that way. So what it is that feelings of sadness are very acceptable. Okay, but like we are saying, if it's pervasive, because someone can be bereaved and be sad and they'll get over it.
Correct.
Someone could, go through a very adverse life event and still get over it, which is okay. So you're supposed to bounce back.
It's natural.
Exactly. But if for some reason you realize that that's low mood, and you can tell actually, you can tell that I'm not happy and this is not me. And depression is clearly a deviation of the person's normal.
Yeah.
So that should let the person realize that there's really something going on. Maybe they can't place a finger on it, but if they go to the hospital, some of these things will come up because there are professionals who can help diagnose some of these in the subtle stages. So clearly you are not happy, you've been sad for 2 weeks continuously for most parts of the day. You're trying to come out of it. Sometimes you even do things to try to come out of it and you are not able to come out. It's just like maybe there's some dark cloud or you're in a dark place, you're trying to find your way out. That should alert you, okay? And then you wake up in the morning, you're usually well rested. You've been able to sleep throughout the night. Usually you're up, you're getting ready for work. And then you feel like you don't want to go throughout the day. Maybe just not one day, but continuously. Aside that, usually you'd like reading or watching TV or spending time with your family.
Correct.
But now you're socially withdrawn. Things that once used to give you pleasure don't even appeal to you anymore. That should also tell you that there's really something going on. Okay. Now, one thing about depression is that it makes you dysfunctional. So if it progresses for some time, you realize that even work, you'll not be interested in working anymore. It gets to a point you don't even want to take care of yourself. So there's what we call neglect of personal hygiene at some point. So some people are depressed and they don't want to brush their teeth. They don't want to do anything. They just want to be there or lie down in bed doing nothing. And then some can even leave their nails overgrown and dirty. At a point where they cannot take care of themselves, they don't want to work anymore. They can't do anything at home. Okay, maybe they like to cook or even take care of the house. Now all those things, they have to be prompted to do it, and it becomes very difficult for them to do those things. Family should help the person because, like he rightfully said, it affects how you think. So at some point you're helpless.
Correct.
You don't even know you're going through what you're going through. Just know that you're in a dark place. That is not you.
Yes.
Okay, it's a complete deviation from your normal self.
True.
But those around you should try to know that this is not how this person is. Okay. For some people, they have what we call crying spells. So they are just crying. And sometimes you don't even know why they are crying. And so at some point, they cry more often, but you can't place a finger on what exactly is making them cry. Even if you could place a finger on it, you know that, that's not how they are.
Okay. I think we're going to come back and hit on that. We're going to take a short commercial break, and when we get back, we'll delve more into depression. Welcome back from the commercial break. Now we're getting back to the subject, depression. I'm hoping that you're all learning something from this. And like I stated before, this is a subject area where we rarely talk about simply because we take it as part of our everyday life. If your health is receding, you're going through a whole lot mentally, psychologically, you assume, okay, it's one of those things. I'm sad today, I'm happy tomorrow. But like Dr. Comfort Ajay just said, she said, if it persists for more than 2 weeks, you should know that's a problem and probably seek help. And I'm hoping this is really, really, really going to educate all of us. And when somebody's going through something like that, do not assume that they're going to be fine. If you're a loved one, you see a family member or somebody going through a depressing state, I believe that the points that we made will actually educate you a little bit to know that it is not right. So we're going back to where we stopped earlier. What were we talking about again? I'm sorry.
So we're talking about at which points should one get help?
Correct.
Or at which points would they know that they are depressed?
Yes.
And they need to get medical attention.
Yes. You were still talking when we had to go for a commercial break. I want you to finish.
Sure, that's fine. So another symptom that could present with depression, with a low mood and everything, are feelings of guilt.
Correct.
So for some people, they'll start apologizing for nothing. Okay? They'll start asking family, loved ones to forgive them for things they really haven't done. Some can even pick their phones, call friends, oh, please forgive me. If I've done anything to you, forgive me. And it is said that even for elderly people, elderly women, for some of them, they could actually start saying that they are witches. They killed this person, they killed that person, and they may not necessarily be true.
And that is under depression.
Exactly. And so sometimes when people start confessing certain things, I mean, the society labels them as being witches. But sometimes it's actually delusions of guilt or feelings of guilt. You understand? And that could also present with a low mood and everything. So like I said, the core symptoms are the three we mentioned. The low or the depressed mood, the low energy, and then the loss of interest or the anhedonia in things they once enjoyed. Those are the very core symptoms. Okay, they must be present.
So in this case, when you were making your submission about mostly in elderly women who actually confess to things they didn't do, is it safe to say that women go through this more than men?
I think largely when you look at the demographics, yes, women tend to generally get more depressed than men.
Okay.
And also with their pregnancy and childbirth, they have, so women have exclusively, if I should use that word, they have peripartum depression.
Okay.
Depression 3 months before, 3 months after. They have a range that they are prone to get depressed. Okay. Then they also have mood changes. Okay. You know, they have a lot of these hormonal changes that seem to give them, that can predispose them or push them to depression. So even within their menstrual period, when they are you know, menstruating and stuff, they could have those mood swings and then swing over to depression.
So it is safe to say that because women, our bodies actually go through a whole lot more than men, we tend to, we're more prone to depression than men.
Yes, their bodies go through more hormonal changes and also more physiological changes with pregnancy and everything.
So how common is depression, by the way? How common is that? I know it is something that is there, but how common, like out of 10 patients, how many would you say actually go through that phase?
Some say as close to about 4 out of 10.
WHO says 5% of the world's adult population. Yes, suffers depression.
So adults tend to suffer more than children?
I think it's diagnosed more commonly in adults, yes, because like I said, it's if you're feeling sad, you can tell. At some point you can tell. But because children present more atypically, it takes an experienced person, you know, or a person, with a very high index of suspicion to be able to tell, because they won't classically present with crying or, I mean, depressed mood, but it tends to affect other areas of their lives. Okay, so
has there
usually
been cases where a child took their own life because they were depressed?
Yes, a lot.
And in fact, we are seeing an increase in suicide rates in Ghana. Lots of children. I mean, it used to be in the universities, but now we are seeing it trickle down to the senior high schools.
So why is it? Why is that?
So a lot of factors contribute or predispose a person to depression. Okay, and in psychiatry we say that there's the biopsychosocial model, or there are biological factors, there are psychological factors, and there are social factors. Among SHS students, I think one of the main things is bullying. Okay, bullying of kids tends to, affect them a lot emotionally. And sometimes if they do not have anyone to open up to talk to them and to help them, they could just easily succumb to depression and then die by suicide. So that's one of the main things. But like I said, biological, so certain people are more predisposed to depression than others, okay? And he mentioned one key group as women, which is true, because women tend to suffer depression a bit more than men. Like, exactly. And like you said,
Why sadly? And
like,
she was the best to suffer
like you said, a lot of hormonal changes occur in a woman. Yes. A lot of hormonal changes occur in women, and it predisposes them. But you see, even worldwide, women are considered a vulnerable group. Okay. And that's because they are probably more likely to suffer some form of discrimination. Okay. Exactly, based on our culture and a whole lot of things. So all these things are social factors that can affect women. Okay. Then psychologically, okay, things could happen that could traumatize someone psychologically. And so all these things, it's not just a one-off something. And you can't say that it is this particular thing that is predisposing the person. It's a complex interaction of all these factors that would result in depression. And it tends to run in families. Okay. So there's a strong genetic predisposition to depression. So if it runs in someone's family, then you can say that you have to be very alert and careful. Just maybe if certain changes are going on in your mind, in your body, just be alert and get help early. Okay.
All right. So I kept mentioning, or I kept coming back to the subject of children who suffer depression, because out here, even in adults, it escapes a lot of people. And even we adults ourselves that go through, sometimes we're not ready to accept that this is what it is. So I brought that up so parents can pay attention to their kids, to take note of everything that is happening with them, simply because kids have the tendency of not being able to express themselves like an adult would. So when you see a change in your child, do not assume that it's one of those regular temper tantrums. If it's gone on beyond a specific number of days, you need to take them in, get the help that they need. And in case you're going through any phase of depression, any phase of it, to a point where you feel suicidal, I have the National Suicide Prevention Helpline here that I'd like you to write down. Maybe not for you, it could be for a friend. Somebody might need it. Then this is a toll-free number. The number is 0800-678-678. 0800-678-678. And this is the National Suicide Prevention Helpline. We'll see you again next week.
Start today, you get health tips with Dr. Daly. Giving you all the health benefits you need for your better life. Watch this show, Health and Life with Dr. Daly. 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 Health and Life.